When you're diagnosed with cancer as a young adult, everyone focuses on keeping your body alive. Blood counts, tumor markers, treatment protocols. But what about your mind? What happens when the anxiety you used to ignore becomes impossible to push down? When the boundaries you never thought to set suddenly become a matter of survival? Today, we're exploring something that doesn't show up on scans or blood tests: the mental health maintenance that becomes just as critical as physical checkups after cancer. We recorded this conversation at Lifeline Emergency Services in Hershey, Pennsylvania, a place where helicopters are maintained with precision, where every system is checked and rechecked to keep people safe in the air. Today, we're talking about a different kind of maintenance: how two young adults learned to maintain their mental health after their worlds were turned upside down by cancer.
So today I'm joined by Eliot and Hailey. And if you'd like to introduce yourself.
Yeah, my name is Eliot, and I was diagnosed at just turned 20 years old with acute lymphoblastic leukemia. I went through about a few years of treatment and was reached complete remission for several years, and then I ended up relapsing and ended up having to have a bone marrow transplant from my brother, who's my donor. And this was about a couple years ago now, so far things are going well, and just got just got a checkup recently, and right now, with the blood counts and everything, my doctor is very happy where things stand.
My name's Hailey. I was diagnosed with acute lymphoblastic leukemia back when I was 12, February of 2020, right before COVID struck. So that was lots of fun. I'm a few years out. I think it's 3. I don't remember. There's too many numbers. Um, but yeah, I'm doing well. Getting ready to go to college and all that fun stuff.
Let's just jump right into our first question. What does health maintenance mean to you now versus pre-cancer?
I never really thought about health maintenance as I now think about it as health maintenance. It was always, oh, I'm just gonna go play my sport. I'm gonna go hang out with my friends. I'm gonna eat whatever I want. Now, when I think about it, it's just like, okay, well, I should do this. It's better for my health. Like, I should go exercise. I should continue swimming. It's good not only for my physical health, but also for my mental health. Also being able to take that into consideration when I'm doing my sports, knowing that not only I did field hockey and I left because it wasn't good for my mental health, even though it was extremely good for my physical health. It wasn't a good environment to be in. So I was able to now look at it and be like, okay, I don't want to stay here. I want to get out of this. Versus, well, before treatment, I probably would have stayed just because, I had a few friends and my mom played field hockey. I should keep playing field hockey and all that.
I've always watched out what I eat, what I put in my body. Um, when I got diagnosed, it was like a complete surprise 'cause I, took very good care of myself. And for me, like the mental health was more important post cancer because I just feel like it's a big part of the healing process for your body. Um, what stress can do can I think it's just as important as physical health, your mental health, and yeah. So I think post cancer treatment, I think my views on mental health have you know been very important to me. So
Yeah. So you both mentioned a component about taking care of your mental health in different ways. Um, do you want to talk any more about like what you were experiencing, the reasons that you left the field hockey team, and
It was very um out of place. Like I felt like I didn't fit in. And then I had people that didn't want to listen to me and were arguing with me on the field and off the field. So my final key was when I had a friend report to me that report is such an official way, but she had heard another friend's mother say that her freshman daughter would get the varsity spot the next year over me because her daughter didn't take a break from field hockey. My break was I learned I had cancer and I had just started learning how to be a goalie. So I could no longer continue to play because I had no hemoglobin. I was effectively dying, and being told that was just a break really hurt me. And I said, okay, I've had problems with other kids. I don't want to push myself to the extreme of being detrimental for me. Like, I'm just gonna take a step back. I swim, so I'm like, I have another sport to keep acting. I'm just gonna keep doing that and get away from the people that are making me feel like I deserve to be doing what I'm doing.
So for you, it sounds like it was more you were, just deciding what your boundaries were and who you were going to let into your life and affect the way that you were feeling and thinking. Um, how about you, Elliot? Like, what kind of attention do you give to your mental health now?
Just more careful of what I put on my plate is one thing, as far as stress goes, not putting so much, trying to pace yourself in, back into school or back in the regular flow of things. And um, so, yeah, I think just being careful and also like being careful what I entertain in my mind. I feel like, when you get cancer and you will realize that, you might die, and you just realize like you really just cut out the BS, and you don't want to entertain anything that's not going to happily, not going to serve you or make you at peace.
What kinds of things do you feel in your body, like when you feel stress or you feel like, oh, I'm just off. I need to think about what I have on my plate right now and rearrange what's working for me. Like, what types of things do you feel within yourself?
My plate, I'm more scared of overfilling it than underfilling it. Um, I want to do everything and I want to jump in exactly where I was before treatment. And I actually had brain damage. I was able to see where I don't have brain cells. So I had dead brain cells in my right frontal lobe and my nope, left frontal lobe and right parietal lobe. Uh, so being able to jump back into sports and everything in addition to my academics is very hard to juggle. So my anxiety plays a big role. And when I get anxious, I overheat. I get nauseous. I'm like, okay, something's wrong. Why am I feeling this way? And I have to identify it. But there's things I can do. I write poetry to try to get anxiety to leave me alone. And just try to take deep breaths and everything. But it's more the anxiety that you deal with anyways. I just lost a lot of my coping mechanisms through cancer because it was, oh, I can just ignore it. Now I can't just ignore it. I have to deal with
I notice that I'll stop maybe eating, or I have a very short fuse with things. Like I'll notice myself getting just like a little agitated. I feel like anybody else, like I feel like anyone can really e- sympathize with that, with feeling of wanting to jump back where you were. But I can relate with that too. And like in hindsight, I realized that I had to, tell myself that slow and steady wins the race. I think it was a very like maturing, growing process for me too.
Is there anything that we haven't covered so far that you would say is something that you put a lot of time and energy into as far as maintaining your health?
I think, doing stuff like this is important. Meeting people who have been through what you've been through and who can relate. Um, I think it's important too. just like have a good people around you, a good support system.
Yeah. The support system. I love meeting other cancer patients, especially being in lockdown during treatment. I didn't meet anybody in the hospital that wasn't a doctor. So it's so much fun to be able to go to events and see kids who were 8 when they were diagnosed, or they were diagnosed when they were 20. Like being able to meet the people who were diagnosed at all these different times, hearing their experiences. Because mine was so unique to myself. Every treatment has their own bumps and their own bruises. I love doing it. I feel like it helps educate other people who don't know what cancer's like too. As I said, I had a friend who didn't know what it, leukemia was. They thought it was blood, blood clots. They thought it was tumors in your blood. Like, I love being able to not really correct, but inform the people, because can't be wrong if you've never knew what it was in the first place. But also just finding the people, even if it's not cancer. I had a friend, she had a significant diagnosis right around the same time as me. And we both share a very dark sense of humor. So like being able to find those people that you can make those really dark jokes with, and they laugh and don't look at you like you're crazy. Um, just not necessarily even I consciously try to find the time for it. It's something that it makes me feel like a better person and makes me feel like I can do better when I am able to interact and able to teach people more.
Yeah. Yeah, that's good for everybody. So earlier today, we were kind of drawing a parallel between like getting regular checkups and talking to the kids about how regular checkups are important, just like regular maintenance to like an emergency vehicle fleet. So like when you guys were kids, mm, did you get regular health checkups like yearly, like they recommend those annual checkups?
I had the yearly appointment, never went like if I got sick or something, every once in a while I'd get like a bad stomach bug or something, but to pull me out of school, I had to be like dying sick. I hated it. Um, but so like when you said you were so surprised because you took such good care of your body, I was never the sick kid. Like, so when I got it, it was actually we had been ignoring it for a while. And we only went once. One of my swim coaches said, "Okay, something's wrong with her. She's falling behind. And this isn't normal." So, yeah, they were normal, but not enough to be like, "Oh, something's wrong."
So then when you think about everything that you went through with your cancer treatments and now living life on the other side, what are your checkups like now?
As I mentioned, I have brain damage. Not did have. I had it. Um, I had seizures and a blood clot thanks to the one med, pegosparaginase. We love that med. Do you remember that med?
Yeah, that's like one of the stronger ones.
Yeah, that's the one that I was told it's very common to be allergic to that one. I had the blood clot from suspected blood clot from it. I got the blood clot, but they can't say definitively it was from that, but that was most likely the medication that caused it. And then I also had anaphylaxis to the medication. So that medication was just a fun ride the whole time. But due to that, I now have to get additional checkups. So I was told, like, I forget how often, but however often we now have to get our hearts checked because of the one medication we were on. Um, we'll have the year. I'm not to survivorship yet, so mine are 6 months. Every 6 months I go to the clinic to make sure that everything's all good and I still don't have cancer. You go through that for a while. And I'm doing all my neuro appointments to make sure that I'm ready for college. I did one right after my seizures. I did another one a year out from cancer treatment. And then I just had the most recent one to make sure everything's ready and prepped for college so that I can get all the accommodations that I need once I'm into college. But right now, there's no medical concerns besides, my left side goes tingly when I do a backstroke start, but we don't know why. So, yeah.
So some of the neuro testing that you've had done, have they identified certain areas where you might need some support at school?
So I actually have a few accommodations that I use almost daily. I have dictation, which is when you get to speak to your computer or you have a scribe, somebody who can write it down for you. Um, I love to write down and handwrite everything, but when I am given that time constraint, because one of my classes we have timed writings, it's very hard for me to just write it down and get it out in the amount of time, but I can get it to my mouth quick enough. So I have dictation from it all, and then I get extended time because it takes a while for me to think through things. And like math class, I have to write down every step or it didn't happen. Um, it's kind of like when you lose that train of thought. For me, it's I have the train of thought, but if it's not written down somewhere for me to look at it, it didn't exist anymore. So I have other ones, like I have limited dexterity on my left hand. So when I do labs and everything, I can ask for an aid. So not necessarily a person, but an object so that I don't have to do stuff with my left hand as much or both hands at the same time. But for the most part, I've been extremely fortunate. And as they told me, my profile does not match my brain scans. I'm performing too well for the how damaged my brain is. How dare you? I know. It's so terrible of me.
And how about you, Elliot? What kind of checkups do you do now with both maybe your oncologist, but then other areas?
Most of my checkups now involve blood work, and then I'll see my doctor afterwards. And because of what I got with the stem cell transplant, I have to do vaccines. So just got a vaccine Monday.
Is there anybody in your family that helps support you in being regimented about your follow up? Or are you in charge of
I'm mother.
that?
Yeah.
Uh,
Mom.
I make my parents make all my appointments.
If it was up to me, I'd probably miss them.
I I want to go to them because while I don't have anxiety about my cancer treatment, I want to make sure I'm as healthy as possible to continue going and everything. Plus, I want to know why my body's doing the tingly thing. I'm also very interested in neuroscience, so it's fascinating on another level. Objectively, it's fascinating, but also I want my body to stop doing strange things. But most of the follow up, it feels pretty redundant. Because as you said, we get blood work so often. I'm down to every 6 months, but like you have to do it more regularly with all your vaccines and everything. Happy I don't have to get those. We actually checked with my doctor because we weren't sure because with blood cancer, you effectively reset your blood. So we're like, do we have to redo all of the vaccinations? I did not. I was very happy.
You both talked a little bit about physical activity. Tell me a little bit about what you do to keep physically fit.
Well, I like to walk a lot, hike. Uh, I I'll go to the gym, and I tend not to do like too many heavy weights and stuff that can, damage because I have, bad bones from some of the treatment I got. So I have to be careful, but so I mostly do like calisthenics kind of stuff, like pull ups and dips and push ups and stuff like that. And then I enjoy playing basketball too, so I'll do that. And been trying to get into running. I used to do it a lot more than recently, but so I'm trying to get back into that too.
You are a brave person for running. I hate it.
Yeah.
I'm as I said, swimmer. So, I continue to swim. I do 2 swim teams, just finished up, but my summer one's starting up soon. I don't really exercise outside of that, but I wanna get back into biking. I love to do that. Much preferred to running. No, I've done 5Ks. I used to do a program called Girls on the Run. There's no group to do it with me anymore. Please get me away from it. I did a class where we had to run like 3 5Ks. It was not a fun class. It was no. I'm like, I can do the walk run. Stop making me try to run the whole thing. Thank you very much. But I plan to go once I get to college because I don't want to really try to start a strict schedule now because it's about to get disrupted in a few months with me going to college and everything. So once I get to college, I plan to like actually go to the gym routinely and try to set up a more strict schedule. I just don't want to start it and then have to stop it because I don't have the commitment to start one right now. I'm going to get back into swimming and I'm a lifeguard too, so I have to stay physically fit for that. So I run and everything, not really by choice, but I do it. Um, so I'm planning to start actually going to the gym once I get to college, but I haven't been told no to anything yet. Um, that's a very good thing because my body hates doing everything. So now I can just tell it to suck it up and do it.
Sometimes with cancer treatments, depending on the medication that you get, it can affect your reproductive system. Have either of you needed to explore anything related to reproductive health?
Pre-cancer, yeah. I mean pre-treatment, yeah.
When they found my cancer, it was to a not necessarily, I don't know the stage it was in or anything, but they said harvesting my eggs would take too long because my mom had actually asked about that. I wasn't concerned, but my mom, very concerned. And it's about a 6 to 8 week process. I learned over the summer at my camp, it's about 6 to 8 weeks to get your eggs harvested. So they're like, we don't have time. You need to go. You need to do this now. There's no time to wait. As far as making sure that I have a way to have children, I have no guaranteed way that I will definitely be able to have children in the future. Due to cancer potentially having killed all my eggs or misformed them or some other thing that the cancer did that I don't know anything about. Um, but I was told due to my blood clot from the one medication, I am not allowed to go on the pill for birth control. I have the pill has too high of a risk of blood cancer, blood blood clots. Um, and because I have to watch that for every medication, but I was told that I should never do the pill. I should do an IUD or some other form of birth control if I wish to get it, but the pill is too dangerous for me.
Yeah, so it seems like you do have quite a bit of education around what you need to do for your reproductive health. Have you had workups to try to determine if you have viable eggs? Is that something that they do?
So one of the things that we did learn is that Four Diamonds will pay for one session of genetic counseling, which means they will pay for one time for me to go to a genetic person. I don't know who I'd go to, but and they'd be able to look do everything, and Four Diamonds would pay for it to tell me if I can have children. So I have not pursued that because I'm not currently interested in that. But once I get to that point in my life, no matter when it is, Four Diamonds will pay for me to do that. Um, Now they won't pay for anything past that point, but I'm extremely fortunate that Four Diamonds is so gracious to let us like find out, can I still have kids? If so, what would that process look like and everything. So
Really, some people would argue that what you want for your future and how you see yourself as either a mom or a husband or a dad it will affects how your mental health is in the long run as well. So, yeah, it's great. That's part of comprehensive care.
yeah.
So, if we were to compare your bodies kind of to a helicopter, what parts do you think needed the most repairs during cancer?
My motor needed a bit of repair. The motor being my brain. It wasn't really repair as it's let's let it sit and hope it fixes itself. Because the brain is so complex that we don't understand it. So after my brain bleeds, that was definitely a major part that's just get better. I don't know. Is the fuel considered its blood? I don't.
Yeah.
Whatever its blood is, it just needed a complete dump and refuel it.
Yeah, yeah. Wherever the bone marrow is needed.
Maybe I don't know. It's the bone marrow. Maybe the I don't know the tubes.
Oil, gotta change the oil out.
Yeah, yeah. It just needed replaced.
I guess you could also say like the pan, the where all the buttons are, the panel
Oh, the
Control
control
panel.
control panel, like your body's, I guess, in a way out of control, and um, something's off, so something needs to be recalibrated.
The wiring in our cells got a bit mixed up.
Yeah.
Oh, yeah. That's a great analogy.
Yeah.
So, has going through a health crisis steered your education or job?
I think it's steered my curiosity in just like health and on college, really. To me, like I became very interested in it, and trying to learn about my treatment, and um always had questions for my doctor. Um and so in a way, like I became very educated about, we the body, and um your blood counts and all that stuff.
My doctors always told me I was the only teenager that actually asked questions. Um, because I was like, okay, I know what, like, because at my age, I understood what was happening in me, but I couldn't really control anything. So my best way of dealing with it was, okay, tell me exactly what's happening. What are we putting into my body? What's going on? So the curiosity about how it all worked and just oncology and leukemia definitely grew. But after it took a little bit of time because my brain had to, regenerate its dead cells. But after that, I became extremely interested in the way that the brain worked, the way that it was good for me to listen to music and not watch a TV show while I was recovering, and that I can now do the things I was able to do, but that I do them differently. Like, I was able to do more complex things when I was first hurt than simple things. I mess up on the simple, not the hard, which I always find fascinating since we don't know much about the brain. It just spurred that interest anyway. Always been a science person. It just helped show me a whole new realm to delve into and learn more about.
It's like a gray area between, like, I mean, there's like childhood cancer, and then there's adult cancer. Yeah. And there seems to be like a gray area that,
Themes.
yeah, and quite frankly, like, you could, like, for me, felt like kind of alone.
I think you bring up a good point, and we do hear that from uh, young adults who had cancer as teens. It can be a very isolating and lonely experience. I think that's what you're touching on.
Yeah. Yeah, like when you go to the clinic, and it's mostly older people, and even in the pediatric world, there's a lot of younger kids, and you just kind of feel stuck between two worlds. Yeah.
It definitely feels very separated because of the whole I'm a teenager, I'm this weird age. It was also very weird because I was 12. So when I'm looking at scholarships as somebody looking into college, I'm looking into all these cancer scholarships and they don't include me. I was too young, or I had the wrong type of cancer, or I'm not sick enough. I don't have enough damage to my body to be considered uh in need of help. And that's another thing. It's almost like imposter syndrome. I feel like I don't belong. I can't call myself a cancer kid because look at me, I'm doing fine. Like, I don't have that. Oh, she's obviously really sick. Oh, she's dying. Like, I'm not dying. And I haven't appeared to be dying for a large part of my treatment. So that little separation that you get is painfully obvious, especially as somebody who just coming out. Like, as we're just coming out of it, like we feel it. Like, it's not just something that we look back on and say, "Oh, well, yeah, it was a little bit." No, it feels terrible because you're like, "Nobody knows how I'm feeling. I'm alone in this," which is another reason why it's so important to go meet other people and find all the people I can to learn and get to know their experiences.
That's what I love about Life on Pause. It brings people together to, share your experiences and help each other find insights about what you went through. And
Yeah.
100%.
Complete health maintenance after cancer means taking care of everything: your mind and your body, your checkups every 6 months, and your mental boundaries, your school accommodations, and your fitness routine, your fertility options, and your support system. It's Hailey writing poetry when anxiety hits and performing better than her brain scans say she should. It's Eliot pacing himself through recovery and learning that slow and steady wins the race. Hailey said it. I can't just ignore it. I have to deal. And Eliot reminded us, you really just cut out the BS. This is what maintenance looks like after cancer. It's comprehensive. It's ongoing, and the pace you're going, whatever pace that is exactly the right pace for you. This has been Life on Pause, a podcast for and by young adults living with cancer. Today's episode was recorded at Lifeline Emergency Services in Hershey, Pennsylvania. Special thanks to Eliot and Hailey for sharing their stories with such honesty and insight. If you or someone you know needs support during or after cancer treatment, Penn State Health Children's Hospital offers comprehensive survivorship programs that include mental health support, physical therapy, educational advocacy, and reproductive health counseling. You can find more episodes of Life on Pause on our website at lifeonpausepodcast.com and on Apple Podcasts, Spotify, and YouTube. Remember, complete health maintenance means taking care of every part of yourself: your mind, your body, and everything in between. All of it deserves attention. All of it deserves care. Until next time,